Greetings to all. I am Dr. Smarth Manhas, PG Radiodiagnosis from Department of Radiodiagnosis, IIMS Nagpur. The title of my oral paper presentation is Evaluation of Prostatic Lesions using PIRADS version 2.1 based multiparametric MRI and histopathology in suspected cases of prostatic malignancies. Coming to the introduction, prostate cancer is the second most common cancer in men worldwide and the fourth most common cancer overall. Traditional methods like PSA testing and DRE are commonly used but have a limited accuracy in detection and prognostication of prostate cancer. MPMRI provides a non-invasive detailed evaluation of prostate lesions. It uses multiple imaging sequences like DWI, DCE, and T2-weighted imaging for comprehensive analysis of prostate. The PIRAD system is based on MPMRI data, and it is a standardized grading system used to evaluate the risk of prostate cancer. The latest version, that is PIRADS version 2.1, has increased prostate cancer detection accuracy and reproducibility. MPMRI can detect prostate cancer and also aid in prognostication by predicting its aggressiveness, leading to more effective treatment planning and reducing the unnecessary biopsies. The aims and objectives. The aim of this study was to assess the role of MPMRI based on PIRADS version 2.1 in evaluation of prostatic malignancies by correlation with histopathological findings. The primary objective of this study was to evaluate the prostate lesions in MPMRI considering histopathological findings as gold standard. The secondary objective of this study was to assess the association of the PIRADS score with serum PSA and PSAD levels of the patients and to assess the association of PIRADS with the Gleason score. Materials and methods. It was a descriptive study carried out in Department of Radiodiagnosis, AIIMS Nagpur, with a sample size of 64 patients. And these were the inclusions and exclusion criteria for the study population, and the consecutive sampling was performed wherein patients suspected of prostate malignancy who came to the MRI department of the AIIMS Nagpur for multiparametric MRI of the prostate were included in the study. Multiparametric MRI imaging was performed on a 3 Tesla MR scanner on a Siemens Healthcare Magnetron Styra as per PIRADS version 2.1 protocol. The extended 14-core cognitive registration trust-guided prostate biopsy was taken as the gold standard for diagnosing prostate cancer following MP-MRI, and the biopsy was performed using endocavitary probe of Mindray DC30 and GE Logic P9 ultrasound machines. The prostate gland was divided into 14 distinct regions on truss, with 7 regions on each side. A single core was taken from each of these regions, with additional cores obtained from the area of suspicion and MP-MRI. This is the image which is showing truss-guided prostate biopsy from the lateral aspect of the right mid gland. Now coming to the results. The summary of histopathological examination. Histopathological analysis showed that out of 64 cases, 19 cases were benign and 45 cases were malignant. Among the participant histopathology findings reveals that 45 patients had acinar adenocarcinoma, 15 patients had benign prostatic hyperplasia with chronic prostatitis, and 4 patients had chronic prostatitis. The distribution of Gleason scores among the patients were as follows. 3 patients had Gleason score of 6, 14 patients had Gleason score of 7, 7 patients had Gleason score of 8, 16 patients had Gleason score of 9, and 5 patients had Gleason score of 10. Summary of MP-MRI findings. The mean of mean ADC value for study population was 0.84, the median of mean ADC was 0.79, and the mean ADC value ranged from 0.45 to 1.41. 29.7% of the lesions with highest PIRADS scores were located in the central gland, 39.1% in the peripheral zone, and 31.2% involved both the peripheral and central gland. Based on PIRADS version 2.1, 20.3% of the patient had the PIRADS score of 3, 32.8% had a score of PIRADS 4, and 46.9% patients had the PIRADS score of 5. Now coming to association between PIRADS score and serum PSA levels, the analysis showed a notable variation in serum PSA levels across different PIRADS groups, with the highest median PSA recorded in the PIRADS 5 group. There was a moderate and positive strength of association between serum PSA levels and overall PIRADS score, indicated by the Kendall's Tau score of 0.49, reflecting a medium effect size. Association between PIRADS score and PSA density. The median of PSA density in PIRADS 3 group was 0.14, in PIRADS 4 group was 0.44, and PIRADS 5 group was 1.17. There was a significant difference in PSA density between different PIRADS groups, with the median PSA density being highest in the PIRADS 5 group, and a moderate positive strength of association was observed between PSA density and overall PIRADS score, as indicated by Kendall's Tau score of 0.48. Now coming to association between PIRADS score and Gleason score. Fisher's exact test was conducted to examine the association between the PIRADS score and the Gleason score. The results revealed a significant difference in distribution of Gleason score across the different PIRADS groups. The strength of association between the two variables was found to be high, with a Kramer V of 0.52, while the biased corrected Kramer V indicated a moderate association between the two. For prediction of malignancy, the PSA density cutoff of more than 0.2 nanogram per ml per cc showed a sensitivity of 89%, a specificity of 58%, and a diagnostic accuracy of 89.1% in the study population, that is, with patients of PIRADS score more than or equal to 3. The ROC curve analysis using a cutoff value of mean ADC of less than 0.95 demonstrated a sensitivity of 96% and a specificity of 74% for predicting malignancy in patients with PIRADS score more than or equal to 3. These results highlight the strong diagnostic value of mean ADC in differentiating malignant from benign lesions in patients' population. Discussion. This study aimed to evaluate the role of MPMRI in assessing biopsy-naive patients suspected of prostate malignancy before undergoing biopsy. It specifically focused on examining the association between PIRADS version 2.1 scores and various parameters, including Gleason score, prostate-specific antigen density, serum PSA levels, ADC values, and histopathology impression. The results showed that significant association was found between PIRADS score and serum PSA density, mean ATC, histopathology, and Gleason score, which highlighted the diagnostic and prognostic value of the multiparametric MRI. Higher PIRADS score were associated with elevated PSA and PSA density, as well as more aggressive cancer, reflected as higher Gleason scores. The study also demonstrated that lower mean ADC values were strongly correlated with malignancy, showing the high sensitivity and specificity for detecting malignant lesions in patients with PIRADS score of more than or equal to 3 in the study population. Now coming to image 1, which is showing PIRADS 3 lesion in the right posterior medial peripheral zone of the apex of the gland, appearing moderately T2 hypointense on axial T2 weighted imaging, showing moderate hypointensity on ATC without any diffusion restriction on DWI. Histopathology following a truss-guided biopsy showed a acinar adenocarcinoma with Gleason score of 7. The image 2 is showing PIRADS 5 lesion, which is involving the base of prostate gland and is showing marked T2 hypointensity on T2 weighted imaging with extra prostatic extension. The lesion is showing marked diffusion restriction on DWI and is showing type 3 curve on dynamic contrast enhancement. It is showing early enhancement and washout. On histopathology, it turned out to be an acinar adenocarcinoma with Gleason score of 9. Image 3 is showing heterogeneous signal intensity lesion in the left anterior transition zone of base of prostate with a T2 weighted PIRADS score of 3, which is showing marked diffusion restriction on DWI/ADC, the DWI score of 4. The overall PIRADS score of the lesion is 4, and it turned out to be Gleason's grade 8 acinar adenocarcinoma histopathology. The image 4 is showing heterogeneous signal intensity lesion in the left anterior transitional zone in the mid-gland, the T2 weighted PIRADS score of 3, and showing marked diffusion restriction on DWI/ADC with a DWI score of 4. The overall PIRADS score is 4, and it turned out to be a Gleason grade 7, 4 plus 3 acinar adenocarcinoma. Thank you very much.